I want to come back, the word collaborate you used earlier. And I believe, and you are working on a project on collaboration, and you want to engage the sector at large to be involved in those conversations. So could you talk, if you want to talk more about the project?
So we have started to explore, just really conceptually at this stage, the idea of shared services and what that might mean for our sector. So are there some activities that all of us are engaged in which we could do more effectively through the use of great technology, for example, minimise some of our costs at the back end so that we can continue to focus on quality service provision. So it's just we've just started that conversation. I know it's not a new idea, it's an idea which a lot of people have potentially thought about and started to explore, but I think, and we think, that there's real potential in that opportunity.
And Alan, from a broader experience, from a governance and quality, why do you feel that there's a value in bringing people together and a shared service model?
My partner works in IT. He always comments, you never subcontract out anything you don't understand yourself. So I think there's some wisdom in those observations. It's important to be on top of your own processes, whether they're for finance or quality and safeguarding. In terms of whether you can subcontract out quality and safeguarding functions, I'd actually be very doubtful about that, because it's really about bringing these issues live at the point of service delivery. And so that, if anything, I think we need to localise quality and safeguarding. We need to get away from understanding this as a function which sits in head office, and we need to incorporate it in day-to-day practice.
I know where you're going, but I want your views on clinical governance frameworks. Most of the organizations have hired nurses and then paid them good money for some time to write documents. So what's your initial take on that? It's delocalized.
I'm not a fan of the term clinical governance. Every time somebody says it to me, I have in my mind a vision of the Bristol stool chart. One of the great things that we've achieved in the disability sector is moving away from medical models to a social model of disability. And I think if we get too caught up in the concept of clinical governance, we will inadvertently bring in some of the concepts from the hospital sector which are inappropriate in our sector. I am, however, a big fan of the concept of practice governance, and really everybody focusing on the quality and the safety and the excellence of the support we're being provided. So in some ways, it's just a question about terms. I do understand that for providers with allied health professionals employed, in some cases they've got regulatory obligation to have clinical governance models in place. That's fine, but really it's about practice that we need to be most concerned about, in my view.
Thank you.